This is Dr. James, and let's talk about the flu. Now, the flu is caused by influenza, okay? And commonly, you'll hear people say that, well, I had vomiting, diarrhea, I had the stomach flu. That is not the flu, okay? A flu is a respiratory illness. It is a cough, it is a runny nose, it is fever, it is chills, it is headache, it is sore throat, it is body aches. The only reason you would vomit with the flu is typically because either your fever gets so high and it makes you nauseous, or more commonly, you are coughing until you vomit. But as far as a true just vomiting diarrhea illness, when people say that they had the 24-hour flu and they're talking about vomiting diarrhea, that is not the flu. That's just a common term, not a medical term. When doctors talk about the flu, we are talking about influenza, and it is a vicious cold virus. The next thing you have to know is that flu comes in two types, A and B. They both make you feel like crap, but I would say that A is usually worse. A has been responsible for more of the pandemics and the deaths from flu. They both make you feel terrible. Flu B will sometimes have a nasty habit of showing up during the summer sometimes, whereas we usually don't see flu A do that. When you get a flu shot, we are trying to predict ahead what flu strains might be there. And usually there will be 2 flu A strains and 2 flu B strains. The problem with the flu is it is always mutating. And so the flu virus that we're going to get this year is going to be different than the flu virus that we got last year. And that's the reason that as humans, we can't really develop much of an immunity to it, is because it's always changing. Coronavirus is a lot the same. That's the reason they have such a hard time with that vaccine, is that by the time they get the vaccine out for coronavirus, the virus is already mutated. Flu mutates a little slower, but it's pretty fast too. It's definitely mutating season to season. So when you're getting a new flu vaccine, it's not the same flu vaccine as you got last year. They're vaccinating against the new strains that they think are coming through. So just know that it happens, and it can be pretty bad. It's definitely harder on the smaller kids. The kids that are less than 3 are the ones that are more likely to get secondary infections. You can end up in the hospital with just the flu, mainly due to dehydration. Again, I told you it wasn't vomiting, but you can get dehydration because you're losing a lot more fluids because you're sweating, you're breathing faster, you're coughing, you feel terrible, you're not eating, you're not drinking. That can end up in problems. But the most common reason is what's called secondary infections. What that is the bacteria that live in our nose and throat that our immune system is normally taking care of and keeping us from having problems with. When we get busy and weak from fighting the flu, those bacteria end up in places they're not supposed to be. So they end up in our sinuses, they end up in our ears, they end up in our lungs, causing sinus infections, ear infections, pneumonias. Those are your most common secondary infections. When you have the flu, we do have medicine for the flu. You may want to talk to your doctor about that. If we can catch the flu within the first 48 hours and get it diagnosed, there are antivirals that you can use for the flu that can decrease the course of the illness, decrease how contagious you are. I do feel, just in my experience, that my bigger, more adult kids don't respond as well as some of the little ones do. The little ones seem to bounce back a lot faster. But again, that's true for just illnesses in general. You treat symptomatically. You want to make sure that you're getting plenty of rest, that you're getting plenty of fluids, that we're treating those aches and pains and making you feel better with Tylenol or Motrin. In kids, there's not a lot of cold medicines that you can do to help them. It's mainly just running a vaporizer and making sure they're drinking plenty of fluids, good nasal suction in the babies. You watch for those secondary infections. Once the fever from the flu went away, so after 2 or 3 days and the fever goes away, and it's gone for 24 hours, it should not come back. If it comes back after that, that's your indication that you need to go back and see the doctor. Of course, if you have any problems breathing, if they have any chest pain, they're having retractions, if they're having pain, screaming because they have an ear hurting or something, always go to the doctor, because the flu is very likely to cause secondary infections. But it's very infectious. It usually wipes out your whole family. Your best prevention is to try and get flu shots every year. good hand washing, staying away from crowded places where there's lots of people breathing the same air and coughing, especially during flu season. Just being really careful. And when it's your baby, well, baby them. And as we always had when I was a kid, you can make the sick island. We used to have this special couch that when we were sick, that was where we were. And it always seemed like mom took extra special care whenever we were on the sick couch. It was almost like a competition to get there. So as we go into flu season, be careful, try and prevent it if you can. And if you get it, just take extra special care of your kids. If you get that fever in the middle or the end, always go to the doctor. That's when you have a higher likelihood of needing antibiotics. Hope that helps.